All right. So in front of you on your screen is the example of your implementation for the new test of competence. Okay. I will read you a scenario. So of course, you only need to write your name here. You will be using a black pen. So the scenario is Andy Boniface was admitted to the medical assessment unit today via GP with an exacerbation of asthma. Andy has had previous admissions to intensive care unit. Andy has been coughing for the last 3 days with production of green sputum. Please administer and document Andy's 1,400 medications safely and in accordance with the NMC standards. So same with the previous document or the old test of competence, the instructions are the same. Okay, talk to the patient, verbalize what you're doing and why, read the chart, complete the documentation, and of course, the correct codes are in your drug chart. Okay, so remember, guys, that you have a different codes compared to the old test of competence. So don't get confused. So check and complete the last page of the chart. You have 50 minutes to complete the station, including the required documentation. Estimate is today, and it's 1,400 hours. So based on our scenario, you are meant to give your 1,400 medication. Okay. So your drug chart is colorful compared to the old test of competence. So let's read it. So the prescription is for you could start with the surname or the forename, doesn't matter for as long as you read it. So let's say surname Boniface and the forename is Andy. The date of birth is the 25th of the 10th, 1982. Hospital number is 1234567. The ward is medical assessment unit. The date of admission is today. The patient's height is 1.83 meters. The weight is 90 kilograms. The BSA is 2.12. Consultant, Doctor Who. And the time of admission is 10 o'clock. So this prescription is 1 out of 1 because historically when we use like pen and paper when we're documenting, they might be like several drug charts for the patient. So it's just indicating that it's just 1 out of 1, that you only have one drug chart for the patient. Okay. So that is your prescription number of prescription records. So next is the prescriber. Name is Doctor Who. GMC is 1512198 signed by Doctor Who, bleep number 123. So for the doctors, guys, the equivalent is the GMC. Okay, the equivalent is the GMC. It's similar with your NMC. Next table. Person administering the medication. So first is Jenny Block. Initial is JB, signed by JB. Base is medical assessment unit. So Emmer, do we need to write anything here? So after you finish your administration of your medication, again, after, you will be writing your name here. Okay? After you finish your medication, you will be writing your name here. Later, I will show you. We will complete this. Okay? So make sure to read your drug chart a bit faster because it's long. Next is allergies. The patient is allergic to penicillin and the effect is rash. Okay? Signed by Doctor Who, blip number 123 today. If the patient is allergic to any medication, keep an eye on that. It might be prescribed on your drug chart. Next is your medication risk factors. The patient is diagnosed with asthma and hypothyroidism. I will give you a tip, guys. So for the medication risk factors, remember, this information reflects the patient's past medical history. Okay? So these two items here on your in front of you guys, it may suggest that one of your medication is intended for this. Okay? One of the medication or couple of medication might be intended for asthma and hypothyroidism. So make sure when you read this section of your drug chart, you understand it and you analyze it. Okay? Because there are instances wherein the candidate doesn't have any idea on what the medications are for. So go back to this section or go and then try to read it again. It may be hinting you something. Okay, so that is a tip on the examination. Next is your second page. Again, the patient's surname is Boniface, the patient's forename is Andy, and all the details are still the same. And I'm happy to proceed. Again, you don't have to read everything because you will run out of time. The information for the prescribers and non-administration or the codes are here readily available. Again, you don't have to read everything because you will run out of time. Okay, so let's break down the different codes for examination. So number 1 is the medicine unavailable. Okay, so I've discussed this earlier. There might be an instance wherein the medicine is unavailable. So as part of your conversation, you have to tell the patient that you have to inform the doctor and check with the pharmacist for any alternatives. Okay, or you need to order the medication as soon as possible. Number two, patient off the ward. So they might be an instance wherein you cannot give the medication because the patient is off the wards. Number three, if the patient administered the medication by himself. Number four, if unable to administer. So this might be like an instance wherein, let's say, the patient say nauseated and the patient cannot take it. Probably we have to like think of other forms such as like IV, IM, or subcut. All right. So that is your number four. And make sure to inform the doctor for the doctor to change the route of your medication. Number five, stat dose given. So going back to our previous example, make sure to check the stat part of your medication. Probably something has already been given to the patient, so you have to omit the medication accordingly. Number six, if the prescription is incorrect or unclear. Again, any missing part of the medication we treat as an incorrect prescription. If the prescription is unclear, of course, if you have doubts in terms of the prescription, you need to escalate that and do not attempt to give the medication. So because you have to demonstrate that you are a safe nurse, okay, that you're a competent nurse. Number seven, of course, similar to what we discussed earlier, patient refusal is also a right. And number eight, nail by mouth. Number nine. So if we compare this other drug chart, so on your codes, you have low pulse and low blood pressure. So keep an eye on that. Okay. So you know your medications for your pulse and for your blood pressure. And of course, number 10, I think a lot of people are asking about this code. It's the others. So looking back on our codes, there is no code talking about allergy. Okay, so number 10 might be your code to indicate that the patient is allergic to something. Okay, so that is it. Remember your number 10, that is the only code that you have to write at the back of your drug chart. So later we will show it. Okay, any questions so far in terms of your codes? It's kind of self-explanatory. Okay, so next table is your once only medicine, the pre-medications, and prophylaxis. So the first medication is today, salbutamol, 5 milligrams. The route is through nebulization. The time required is 10:30. Signed by Dr. Khan, 123. Time given at 10:30. Given by JB. Checked by Yoli Limbu. Um, so if we analyze this prescription, this medication has been given. So we don't need to do anything at this point. Next is today, ipratropium bromide. The dose is 500 micrograms. The route is nebulization. Time required 10:30 in the morning. Signed by Dr. Khan 123. Time given at 10:30. Signed by JB and checked by Yole Limbu. So again, similar with the previous one, it was given already, so you're not meant to do anything because again, we are giving the 2 o'clock medication. Next is today paracetamol, 1,000 milligrams IV. The instruction is it's for pain or for headache. Time required is 11 o'clock. Signed by Dr. Khan with bleep number 123. Time given 11 o'clock. Signed by JB and checked by Yoli Limbu. So similar with your first two, you don't need to do anything at this point. Last medication is your prednisolone, 40 milligrams per RM. Um, Time required 1400, signed by Dr. Khan, bleep number 123, checked by Yoli Limbu. So based from this prescription, are we giving this or not? And what is the medication for? The answer would be yes. Okay? Yes. But check the regular medications first. Well done. Well done. Thank you for your answer. At this point, we are giving the prednisolone. Levelin said, check the regular medication first. So the only thing is, remember the hierarchy whenever you're giving the medication. It's always stat dose, the regular, and the PRN would be the last. Why do we call it stat? You have to give it now. Yeah? You have to give it now. So that means it's the top of your list. So you have to you have to give the prednisolone now as a stat dose. Of course, this is steroid. So probably for this scenario, you are giving the prednisolone to reduce the inflammation on the patient's airway to relieve the patient's shortness of breath. Okay, so that is your main reason why you're giving the prednisolone for this patient. So I think someone answered the asthma. Yeah, that's correct. Remember, prednisolone, it doesn't come with 40 milligrams. Okay. So in the UK, the preparation for prednisolone is it's 1 milligram per tablet. Okay. Or 5 milligrams per tablet. So let's try your basic math. So let's say you have 5 milligrams per tablet. How many tablets you're giving? Eight. Well done. Okay, well done. If you're giving prednisolone and let's say you're meant to give 8 tablets, please, guys, to count the tablets you're giving. Remember, for prednisolone, guys, what's the most important thing? You cannot stop prednisolone abruptly. Remember, we have to wean it off. Okay? You have to taper the dose until it's completely gone. So somebody mentioned about checking the blood sugar. Well done. Okay? Well done. Of course, you have to consider that. But you don't need to ask that from your assessor. But again, probably as part of your conversation, you have to inform the patient that you may need to check the patient's blood sugar because we know that steroids could increase the patient's blood sugar level. So well done. Remember, for this scenario, we are giving prednisolone. Next page. So this prescription chart is still for Andy Boniface, and all the details are still the same. And I'm happy to proceed. So prescribed oxygen, the patient is not a CO2 retainer. Okay. Um, the patient's target saturation is 94 to 98%. So if we check this particular table, you could see there is an oxygen device prescribed. So starting device and flow rate, it's Reserva mask. The start is today, the date is today, the time is 10 o'clock. The FRD or the flow rate and device is 15 liters per minute, and it's a Reserva mask signed by Doctor Who. Stop date is today. Print name is Doctor Who, and then checked by Yoli Limbu. So if we analyze this particular table, it means that the rest of the mask has been discontinued. Okay? It has been stopped. It's written here, stop. So that means when you're talking to your patient, there is no oxygen. What is the question that you might be asking from the assessor? So assessor, may I know the patient's saturation levels, please? You could also ask the respiratory rate. Remember, there is a target saturations here. It says here 94 to 98%. Okay? So make sure that the patient's saturation is within the normal or the target range. Okay. So let's say, what if the assessor said, oh, it's 90 nurse? What will you do next? Of course, you know the drill, the magic words. You have to escalate and intervene. Okay. That's it. So again, just to recap, check the patient's saturation levels and respiratory rate and make sure to know the codes for the oxygen. Okay. You don't have to memorize it because it's there. It's readily available again. Next page. There's something missing on my presentation. So I think I lost the header. Okay. So there should be a header here saying the patient's details. Okay. So let's pretend it's there. So let's say drug chart for Andy Boniface. All the details still the same. I'm happy to proceed. So the first medication is comoxiclav. The date is today. The dose is 500 milligrams per 125 milligrams. The frequency is 2 times a day. The route is per RM. Duration is for 5 days. Start date is today. Finish date is for 5 more days. Culture sent, yes, signed by Dr. Khan, 1, 2, 3. This morning, it wasn't given by JB. What does code 2 mean? So code 2 means the patient was not in the ward. So JB did not administer comoxiclav this morning because the patient was off the ward. So you have to explain what the code is all about. Yeah, so you have to explain it to your assessor. So type your answer. Are we giving this medication or not, and why? Why do you think, Paulina? Why are we not giving it?
Patient is allergic to penicillin.
Well done. There you go. Thanks, Paulina. Thank you for that. So, coamoxiclav, it contains penicillin. All right. So remember that. Okay. So Paulina said she will omit this and escalate in Datex. So probably for the people who's still in the Philippines, you might be wondering what Datex is. So Datex is the alternate name for incident reporting because it's a near miss. Okay, it's a near miss. Remember, the doctor prescribed a medication wrongly. Is there a risk of us giving this medication? Of course. Yeah, of course. So the day text, again, is not to blame somebody. Okay. The main reason why we're doing a day text is to improve the practice. Okay. So this will not happen again. Okay. So again, the day text is meant for us to improve the practice and prevent this from happening in the future. So we learn from our mistakes and improve the system. So that is your day text. Okay. This part, of course, you will tell the patient, this prescription is wrongly prescribed and I cannot give you this prescription or this medication. I will escalate this to the doctor and do a day text. So the doctors could remove this on the prescription. Because what if you're not intervening? Let's say, what if you're not doing a day text, or why if you're not escalating this particular instance or occurrence with the doctors? The next nurse, who might not be as clever as you are, might still administer the medication. Yeah. And it may result to a drug error. Okay? If you read between the lines, JB could have given the medication and she could have killed Joe. Okay, so that is your co-amoxi class. So please remember that. Later, we will show you on how to document. Next is our next page. I'm really sorry. I think my document, it moved. This one, this section should be on the top part. Yeah, I think it moved. I'm really sorry. So the next medication, clarithromycin. Okay, so the date is today. Um, the dose is 500 milligrams. The frequency is twice daily. The route is per RM. Duration is for 5 days. Start date is today. The finish date is for 5 more days. The culture has been sent, signed by Doctor Who 123. The date is today. It was given by JB at 11 o'clock in the morning. So based on your prescription, are we giving this or not? So it's not due yet. Remember, we're only giving 1400 medication. So just tell the patient, this is your antibiotic, but it's not due yet. What does clarithromycin fall under? Is it a penicillin or not? What is the drug classification of clarithromycin? If you know the answer, please type it on the comment section. So next page. We are now moving on our next page, which is our regular medication. I'm really sorry, guys. My document moved. So normally you will see the patient's details again. So it should be, let's say, Andy Boniface, and um, all the details are still the same, and I'm happy to proceed. The first medication is theophylline. Okay. So the date is today. The dose is 200 milligrams. The frequency is twice daily. The route is per RM. Duration is for 5 days. Start date is today. The finish date is for 5 more days. Signed by Dr. Khan, 123. It was given this morning by JB at 11 o'clock. And the next time due is 2300. It's not due yet. What is theophylline for? Please type your answer. Who could answer me? What is the drug classification of clarithromycin and what is theophylline for? Next is levothyroxine. The date is today. The dose is 100 micrograms. The frequency is once daily. The route is per RM. The duration is ongoing. Start date is today. The finish date is ongoing. Signed by Dr. Khan, leap number 123. Please type your answer. Are we giving this medication or not? Based on the prescription in front of you, are we giving this or not? And at the end, it says here, checked by Yoli Limbu, and the prescription is unchanged. Are we giving this or not? So what is levothyroxine for again, guys? Help me. Hypothyroidism. Well done. So Florence said, normally we administer the levothyroxine early in the morning before breakfast. That's the ideal. Okay. And we are giving this because this is a correct prescription. It's correct and it's due your time. Forget this. I might forget this. So if you see on the right hand side of your screen, you can see some notes. Yeah. New, amend, unchanged, supply at home. So the reason why it's here, because pharmacists, they normally screen the patient's medication. So if we analyze this particular levothyroxine, that means the patient's prescription is unchanged. So the patient has been taking this from home, okay, for quite some time now. So similar with the theophylline, if let's say it's take like, let's say, as new, that means it's a new medication for the patient. Yeah. So that's what it means on your examination. Amended, of course, for obvious reason. if let's say they've changed the date, the time, or the frequency of the medication or the dosage, okay, it's amended. So in the UK, normally when we have admissions, I think similar with the Philippines, the pharmacist will screen all the patient's medication and they will put a note if they amended or they changed the medication or if the medication is a supply from home. So that is your levothyroxine and your theophylline. Okay. So next we carry on.